Let us begin by discussing the use of fulguration in managing superficial lesions.
Fulguration uses electric current to destroy abnormal tissue found in superficial tumors.
How effective is fulguration in the treatment of these lesions?
It is highly effective for controlling small superficial lesions while minimizing invasive procedures.
Now let us turn to cases of recurrent colicky abdominal pain and the role of cystine stones.
Cystine stones originate from a genetic disorder causing cystinuria and are diagnosed through the presence of crystals and red blood cells in urine.
In urine microscopy, how do the crystals assist in confirming cystine stones?
The presence of characteristic crystals along with hematuria gives a strong indication of cystine stones.
Moving on, what can we learn from an upper gastrointestinal endoscopy showing esophageal varices?
Esophageal varices are dilated veins in the esophagus associated with portal hypertension and liver disease.
What is the importance of identifying esophageal varices in patient management?
Early detection is crucial as they can lead to life-threatening bleeding if left untreated.
Let us now discuss findings that differentiate renal cysts from other renal lesions.
Renal cysts are typically benign and are often discovered incidentally on imaging studies.
What factors are considered when managing a renal cyst?
Factors include the size, symptomatology, and potential complications, with intervention reserved for symptomatic cases.
In the case of a child with sudden severe scrotal pain after trauma, what diagnosis should be suspected?
The clinical picture suggests testicular torsion with gangrene requiring urgent surgical management.
Why is prompt intervention essential in testicular torsion cases?
Delays can lead to irreversible testicular necrosis and loss of function.
Turning to breast lesions, how do we differentiate a Phyllodes tumor from other benign tumors?
Phyllodes tumors show a distinctive leaf-like histological pattern and can be larger with potential for malignant behavior.
What is the recommended management for a Phyllodes tumor?
Surgical excision is recommended to prevent recurrence and address any malignant potential.
Let us explore the use of VAC dressings in wound management.
VAC dressings apply a controlled negative pressure, typically between 120 and 130 mmHg, to enhance wound healing.
How does this level of negative pressure aid wound recovery?
It promotes tissue granulation, removes excess fluid, and reduces edema at the wound site.
Now consider the surgical procedure of Nissen fundoplication for treating gastroesophageal reflux disease.
Nissen fundoplication wraps the upper part of the stomach around the esophagus to prevent acid reflux.
In congenital inguinal hernia repairs, what structure is crucial to identify and preserve?
Preserving the testicular vein is important to ensure proper venous drainage during hernia repair.
Let us discuss the technique of taking an edge biopsy in large lesions.
An edge biopsy obtains tissue from the margin when complete excision of a large lesion is not feasible.
What role does inosculation play in the survival of a skin graft?
On the third day after grafting, inosculation allows the graft to connect with the recipient blood vessels for nutrition.
How are venous ulcers identified and differentiated from other types of ulcers?
Venous ulcers are shallow with irregular borders and typically occur in the lower legs due to venous insufficiency.
When evaluating a patient with neck swelling, what thyroid-related tests are important?
Evaluation involves testing T3 and T4 levels along with thyroid-stimulating immunoglobulin when hyperthyroidism is suspected.
In the context of postoperative care, what is the function of a ROMOVAC drain?
ROMOVAC is a closed suction drain that effectively removes fluids from surgical sites to prevent complications.
Let us now address toxic exposure in children. What effects can chemical rotenone have?
Rotenone inhibits NADH dehydrogenase, resulting in disruption of cellular energy production and can lead to unconsciousness.
Could you elaborate on the manifestations of Pompe disease?
Pompe disease is a glycogen storage disorder presenting with hypotonia, dilated cardiomyopathy, and hepatomegaly.
What impact does carnitine deficiency have on muscle tissue?
Carnitine deficiency impairs long-chain fatty acid oxidation, causing accumulation of fat vacuoles and exercise intolerance.
In nutritional deficiencies, which vitamin deficiency is associated with pellagra in populations consuming maize?
Pellagra is due to niacin deficiency and present with dermatological, gastrointestinal, and neurological symptoms.
How does methotrexate contribute to the development of mouth ulcers?
Methotrexate inhibits dihydrofolate reductase, leading to a decrease in thymidine monophosphate necessary for DNA synthesis.
In enzyme kinetics, why does competitive inhibition result in an increased Km while Vmax remains unchanged?
Competitive inhibitors compete with the substrate, which reduces binding affinity and increases Km without affecting the maximal reaction rate.
Which drug used in hyperlipidemia treatment is known for causing facial flushing?
Nicotinic acid is known to cause facial flushing due to its vasodilatory effects.
What condition is associated with increased chylomicrons and a lipemic serum profile?
Lipoprotein lipase deficiency leads to an accumulation of chylomicrons resulting in a lipemic serum.
How does iron deficiency anemia present in laboratory investigations?
It presents as a microcytic anemia with a low mean corpuscular volume and increased total iron binding capacity.
In cases of phenylketonuria with normal phenylalanine hydroxylase levels, which enzyme deficiency should be considered?
A deficiency in dihydrobiopterin reductase may mimic phenylketonuria symptoms and requires appropriate testing.
What clinical features point toward Marfan syndrome?
Marfan syndrome is characterized by tall stature, long digits, and increased arm span and lens subluxation.
Why is it important to screen for iron deficiency in patients with signs of anemia?
Early identification with laboratory measures such as low MCV and high TIBC can guide effective treatment for iron deficiency anemia.
Lastly, what metabolic changes are seen in methanol poisoning?
Methanol poisoning results in the accumulation of formic acid and lactic acid, which contribute to metabolic acidosis. Ending. Thank you for joining this episode. Our discussion covered key insights into NEET PG exam questions and a range of clinical concepts. We hope you found this podcast informative and engaging. Please tune in next time for more educational discussions.